नमस्ते बिटिया हमेशा खुश रहो बिटिया A very good morning to all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at the Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about the clinical aspect of the invasive procedures that are used in the diagnosis of respiratory system disease. So, what are invasive procedures? Invasive procedure is a medical procedure that invades or enters the body, usually by cutting or puncturing the skin, or by inserting instruments into the body for diagnosing a disease procedure. So what are invasive procedures? These are basically medical procedures that invades or enters the body, and usually by cutting or puncturing the skin or by inserting instruments into the body for diagnosing the disease procedure or the disease picture. Invasive procedures in respiratory system includes laryngoscopy, bronchoscopy, mediastinoscopy, thoracentesis or pleural aspiration, ventilation, perfusion scan, pulmonary angiography, and lung biopsy. These are the most common invasive procedures that are commonly used in the respiratory system diagnosis. We are going to discuss today one by one each of them. Laryngoscopy. What is a laryngoscope? Laryngoscopy is the examination that gives a doctor or a physician the close-up view of the larynx and throat of the patient. The larynx is basically the voice box. So, using the laryngoscopy, you can view the voice box clearly. It is done by otolaryngologist, and the instrument used is a fiber optic bronchoscope, or it is also known as a laryngoscope, which gives magnified view of larynx to detect the small lesions. This is basically laryngoscopy using a laryngoscope, and you can visualize all these things. You can visualize the epiglottis. This is the voice box. So you can visualize the true vocal cord, you can visualize right side, left side, and you can also visualize the arytenoid cartilage. Now we come to bronchoscopy. What is bronchoscopy? Bronchoscope is an instrument that is used to have a direct and magnified view of the bronchi. And for that, bronchoscope is used. There are two types of bronchoscope that are commonly available. We have a fiber optic bronchoscope that is most commonly used, and a rigid bronchoscope. So, why do you do the bronchoscopy? So, the structural changes of the bronchi can be seen through the bronchoscope in form of obstruction or distortion of the airways. Through the bronchoscope, one can collect bronchial secretions, bronchial washings or lavage, and brushings, that is exfoliative cytology, for histopathological and cytological examination. The bronchoscopy and the biopsy of the lesion can be taken for histopathological changes. So, using a bronchoscope, not only you can visualize the bronchi, but you can also collect the specimen for histopathological changes. Biopsy can also be done. So, this is the procedure of bronchoscopy using a bronchoscope. So, you can use the direct one or the fiber optic one. Now, the third procedure is mediastinoscopy. Mediastinoscopy is an important procedure that is used to examine the mediastinum. It is the space, the mediastinum is the space behind the sternum in the middle of the chest between the two lungs. It contains lymph nodes. Mediastinoscope is passed through the suprasternal notch into the mediastinum to have its direct view. It is performed in the mediastinal lesions such as lymphadenopathy and bronchial carcinoma. So, mediastinoscopy is done mostly in case of lymphadenopathy and bronchial carcinoma. This is how mediastinoscopy is done using the mediastinoscope that is directly inserted through this level. The incision is made at the level of the sternum and is directly introduced into the mediastinum. You have to make the incision like this, And then you can see the trachea. Through the trachea, left lung, right lung, lymph nodes can be visualized. The next important procedure is thoracentesis or the pleural aspiration. Thoracentesis is a procedure to remove the fluid from the space between the lining of the outside of the lungs, pleura, and the wall of the chest. Normally, very little fluid is present in this space. Usually in the lungs, very little fluid is present. So pleura is basically the space between the lining of the outside of the lungs and the wall of the chest. So normally there is no fluid present, but if there is accumulation of excess fluid between the layers of the pleura, then the condition is known as pleural effusion. So the pleural effusion is aspirated with the help of aspiration needle or by intercostal tube or catheter that is introduced into the pleural cavity through one of the intercostal spaces occupying effusion or empyema. So what we are doing here is we are aspirating with the help of aspiration needle or by intercostal tube or catheter that is introduced into the pleural cavity through one of the intercostal spaces overlying the effusion of empyema. So this is the process of thoracentesis, where an incision is made in 1 to 2 intercostal space below the upper level of pleural fluid in the mid-scapular line or 5 to 10 centimeter lateral to the spine, and then the fluid is collected in the bottom. Now, another important invasive procedure includes ventilation perfusion scan. The ventilation perfusion V2 scan is a nuclear medicine scan that uses radioactive material, that is radiopharmaceutical, to examine airflow, ventilation, and blood flow, that is perfusion in the lungs. The aim of the scan is to look for the evidence of any blood clot in the lungs that is called as a pulmonary embolism. Ventilation perfusion scan are usually 2 scans performed simultaneously. One by inhalation of the radioisotope 133 xenon gas, that is ventilation scan, and other by intravenous injection of radioisotope 99M technetium labeled microaggregates of albumin, that is perfusion scan. The corresponding areas are compared both on perfusion and ventilation scan for pulmonary thromboembolism. So this is how the ventilation perfusion scan looks like. It is showing pulmonary embolism in the right upper zone. You can see the defect here in the lungs. This is the perfusion scan and this is the ventilation scan. Next we come to the next invasive method is the pulmonary angiography. Pulmonary angiography is a test to see how blood flows through the lungs. Angiography is an imaging test that uses X-rays and a special dye to see inside the arteries. This is done by pushing the dye into the main pulmonary artery via the catheter introduced through one of the femoral veins and advanced into main pulmonary artery through the right side of the heart. So we are doing basically angiography in this. So pulmonary angiography to show the blood flow through the lungs. This is how you can see the blood flowing through the lungs. You can see the blood vessels in pulmonary angiography. Pulmonary angiography, it is a test to see how blood flows through the lungs. This angiography is an imaging test that uses X-rays and a special dye to see inside the arteries. This is done by pushing the dye into the main pulmonary artery by a catheter introduced through one of the femoral veins and advanced into the main pulmonary artery through right side of the heart. Now, the next invasive method is lung biopsy. A lung biopsy is a procedure in which the samples of the lung tissue are removed with a special biopsy needle or during the surgery to determine if lung disease or cancer is present. Transbronchial biopsy taken through the bronchoscope is studied for bronchial lesions. Transthoracic needle biopsy of the lung is done under CT guidance for peripheral pulmonary lesions. So this is the method of CT guided biopsy, where we use fine needle aspiration biopsy of the lung to detect for any kind of pathology involved. So this was all about the invasive methods used in case of respiratory system examination. In the next lecture, we will be starting with examination of the GI system. So this session was powered by digital version 2.0 JAYOTI VIDYAPEETH University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.